I appreciate the opportunity to give the business perspective. In our view, Obamacare is like a Scud missile that's aimed at every small business in Texas. Just to mention 2 quick points. The first is a direct tax on jobs. The proposal calls for an 8% tax on all wages of those employers who do not currently provide health insurance. It's our belief that many employers who are struggling to provide health insurance will simply drop their insurance and pay this tax because it will actually cost them less. So it'll increase the number of uninsured. It'll also, obviously, as a job tax, decrease the numbers of Texans who are unemployed at a time that we're suffering through a recession. The governor and Brooke both touched on Medicaid. This bill, if it is enacted into law, will create and cause massive tax increases in Texas through expanding eligibility for Medicaid. Currently, Texas does a good job of providing for those who are truly in need, but this will greatly expand eligibility for Medicaid, costing the state taxpayers roughly $3 to $6 billion per year. Obviously, a number of this magnitude would be a precursor to a tax increase. You know, it's our belief that what President Obama is doing with his policies is trying to do to Texas what California has done to itself. We cannot allow this to happen, and we appreciate the governor's leadership in fighting this issue. It's now my great pleasure to introduce our next speaker, Dr. Wang. Dr. Wang is a cardiologist with the Austin Heart and the Heart Hospital of Austin. He went to medical school at UT Southwestern and obtained a law degree from the University of Pennsylvania and a master's degree from Harvard. He currently sees patients in Austin and LaGrange and serves as the practice's Director of Legislative Affairs. He is here today to provide his perspectives as a physician coming from one of the most highly acclaimed cardiologist practices and cardiac hospitals in the country. Dr. Wang.
Good morning, and thank you for inviting me to speak. I'm glad to be joined today by my colleagues from Austin Heart and from the Heart Hospital of Austin who are standing with us here today. From my perspective as a cardiologist who sees patients in Austin and in LaGrange, this report comes at a time of great progress in cardiology. Death rates are down 30% from heart attacks since the year 2000 because of innovations and progress in cardiology care. So we know that what we are doing saves lives, lots of lives. Yet there is so much more to be done, as 1 in 3 Americans has a cardiovascular disease, and heart disease remains the #1 killer among men and women in America. Moving forward, we must make sure that we continue to be able to take care of our patients by providing the highest quality of cardiac care with appropriate access. Now, I was asked to speak today because our practice and our hospital are proof of the great successes that can be achieved in the delivery of cardiac care. I represent Austin Heart, a group of 47 cardiologists that is the largest provider of cardiac care in Central Texas. We cover 16,600 square miles of Texas. I also represent the Heart Hospital of Austin, a specialty hospital that is managed with a high level of physician involvement. Just last month, a study funded by Medicare showed that the Heart Hospital of Austin had the lowest death rates from acute heart attacks of any hospital in the entire country. The Heart Hospital of Austin has been rated the #1 cardiac program in Texas for 6 consecutive years by Healthgrades. No other hospital in the state has achieved that distinction more than once. Austin Heart, my own practice, has board-certified physicians, nationally certified imaging programs, world-class research, and innovative quality assurance protocols already in place. In addition, we see more patients per physician than similar practices nationwide. We have quality physicians, we are accessible to our patients, and we have quality tools to do our job unimpeded. And what we are doing works. Not only does it work, it produces some of the best patient outcomes in the entire nation. Therefore, we are concerned with any proposal that comes between us and our patients because any interference could result in less timely and lower quality health care. As an example of this, an immediate threat to my ability to take care of my patients is a proposed Medicare regulation based on erroneous calculations. If implemented in January 20 as planned, It would force cardiologists across the country, and in my practice, to close offices. It would restrict access to quality cardiac care. And the people to suffer the most from this would be our patients. So my bottom line, and what I've started telling my patients, is that as consumers of healthcare, when evaluating proposals, they need to ask themselves, 1, will my physician be able to see me as needed? 2, will my physician have the quality tools to take care of me? And 3, will my physician be able to take care of me without interference? This is our benchmark for the success of any legislative or regulatory proposal. Thank you very much, and I present back Governor Rick Perry.
Well done. Dr. Wang, thank you very much. That is not only heartfelt, but spot-on analysis of what we're looking at, and thank you for your hard work. Donna, thank you for your words. She gives us some insight into this healthcare reform bill and its likely impact on Texas. And Bill, thank you, of course, for being here today and for representing the small businessmen and women across the state of Texas who are the real engine that drive the Texas economy. And you're pretty good about speaking plainly and directly. And you clearly understand something about creating jobs in the state of Texas and the real creators of those jobs, the Texas business community. So thank you for your work, and to Brooke again, to you and the Public Policy Foundation for the research and interpreting these issues for Texans as we try to make our way through this national discussion that's going on. You know, the legislation detailed in this report doesn't bode well for Texas. I would suggest to you this is bad news for Texas. Once again, the federal government is bearing down on the states. It's preparing to take greater control through mandates, trampling innovation through runaway costs. Yeah, I'm continuously amazed, but not surprised, at Washington's remarkable, consistent approach, combining a willingness to spend money they don't have on solutions that they haven't thought through for problems they really don't understand. There is no question that there are aspects in our healthcare system that are in need of repair and reform. But issuing top-down mandates on a breakneck schedule is a surefire way to make things worse. It's ironic that folks in Washington would look for inspiration to Canada. They're looking north, a place where the single-payer system is on the verge of imploding. And those aren't my words. That's what the incoming president of the Canadian Medical Association said just the other day. The current president also admitted that competition should be welcomed, not feared, at a time when our neighbors to the north are experiencing the consequences of trying to do all things for all people, desperately seeking ways to reintroduce a little free enterprise into their collapsing system. Our leaders in Washington are trying to drag us down that same failed path. It's my sincere hope that those leaders will spend a little less time talking at their town hall meetings and a little more time listening to people like those here today, individuals that you've heard from, the doctors who administer the life-saving procedures, the hospitals who invest in state-of-the-art diagnostic equipment. I hope they'll also take the time to realize the terrible impact of increased taxation, because the dollars they discuss come from somewhere, and that somewhere is just about always the purses and wallets of everyday Americans, of Texans, who are already working hard to stay afloat during these tough economic times. The fact of the matter is that we are continuing our efforts to reform health care here at the state level. 2 years ago, I laid out a comprehensive plan to transform health care in Texas. I requested a federal waiver to let us make changes. The plan focuses on state-specific solutions that will eliminate costly federal mandates and use those resources to provide more low-income Texans with insurance, reduce the expensive emergency room visits for basic care, and make it easier for the working poor to buy into employer-sponsored insurance. Sadly, the glacial pace of progress in Washington has held this up, as the waiver that would allow us to pursue real reform has been stuck somewhere in the federal system for over a year. It is clear Washington has no interest in allowing states to pursue their own tailored solutions to problems that affect our citizens.